So next we're going to talk about iron deficiency anemia. So we'll start, as we start with every blood smear, by looking at the feathered edge and just taking a look to make sure that we don't miss something out here that we wouldn't see in the zonal morphology. And so after you scan the feathered edge and you determine that there's not really anything that you're going to miss, we find our zonal morphology again by going two 10x fields in. And here, the first thing that you can note is there's a lot more white space than we typically see in a normal blood smear. The white cell count is relatively normal in this specimen, but the red cells are widely spaced. And even at this power, we can see that there might be an increased platelet count. And so if we go a little bit closer, we can scan around and look at the white cells just to get a familiarization with the white cell morphology. And here again is a prominence of platelets in the background. So we already think that this is probably has a higher platelet count than we're used to seeing. And after we determine that the white cells are relatively normal, we can go on 100x. And at 100x, we can see that the red cells may be smaller than usual. And so there's one here in the center of the screen that really would be smaller than we would think of as normal. And a good reference for a red cell, if you're wondering about is the size of the red cell too big or is it too small, is to look at a normal mature lymphocyte nucleus. So typically red cells are the same size as the lymphocyte nucleus in a mature lymphocyte. And so here in comparison, we have a normal mature lymphocyte here in this field, and you can see that the nucleus is larger than the background red cells. And so we have a sense that the red cells are smaller than typical. And so we wouldn't want to make that call just solely based on this, but we would want to use all of our red cell indices that come with our blood smear reports. So this is a case of iron deficiency anemia. And so some other things that you can see in the red cells with people with iron deficiency anemia is increased central pallor. And so these are most evident in these smaller, really smaller cells. So this one seen in the center shows more than 2/3, I would say, central pallor. And so what we want to see is kind of a 1/3 central pallor and the remainder of the red cell showing no pallor. And so here we can see some target-shaped cells, but you'll notice that many of these cells have increased central pallor. Typically in the red cell indices, the MCV, MCH, and MCHC are all decreased, and the RDW is going to be increased. Thrombocytosis also frequently accompanies these iron deficiency anemias, and so here we can see our guess at low power confirms that there are quite a few more increased number of platelets than we typically see. But again, we would want to confirm this with the automated platelet count that comes with the peripheral blood smear. So to confirm this diagnosis of iron deficiency, we would have to either suggest or hopefully, if the clinician is concerned enough about it, has already ordered the iron panel. So hopefully they will have ordered a serum ferritin, serum iron, a transferrin, and a iron binding capacity. Typically in iron deficiency anemia, the reticulocyte count is going to be decreased, and that is due to the fact that the patient is not able to produce red cells appropriately because of the lack of iron available. And so although there may be reduced numbers of red cells, the body is not able to compensate for that by increasing the amount of early red cells in the peripheral blood. The gold standard for iron deficiency anemia is absence of iron in the bone marrow. However, this is neither necessary or is it routinely done in diagnostic workup. And lastly, I just want to comment on the number of elliptocytes seen in iron deficiency anemia. These are often called pencillate cells due to the fact of their skinny and elongated morphology. And here, as we scan around, you can see a number of these pencillate or elliptocytic cells. Here we see, in contrast, a case of blood loss anemia. And so for this patient, they have increased white space between their red cells. However, their deficiency is not in iron, but actually they're losing blood. And so if we go a little bit closer, we'll notice some differences between the morphologies. So here we see that the red cells aren't necessarily decreased in size. There are far fewer elliptocytes than we were seeing in the previous case. And importantly, they show these reticulocytes. So these are those purplish, less eosinophilic red cells that we can see kind of scattered all around in this peripheral blood smear. And so that's a sign of red cell regeneration. So these are earlier red cells just coming out of the bone marrow. And this is a sign that the patient is trying to regenerate their red cells. So when reticulocytes are increased, it means that the patient is trying to produce more red cells. And in this case, this is an appropriate response since the patient is losing red cells. The reticulocytes are increased to help offset the red cell loss.